We have a KATU medical alert. Receding gums can lead to pain, tooth decay, tooth loss. While often associated with older people, gum recession is not uncommon for people between the ages of 18 and 45. And fixing it usually involves grafting tissue from inside the mouth and a lot of sutures. As Brian Wood explains, a relatively new, less invasive procedure can eliminate the stitches and post-op pain.
Nice to kind of share with.
A less invasive procedure to treat gum recession called Pinhole Gum Rejuvenation is now the preferred method. More than 2,000 dentists have been trained by Los Angeles dentist Dr. John Chow in the past several years. One of the first was Dr. Kelly Blodgett, who sees patients in Portland with gum recession due to overvigorous brushing, tooth grinding or clenching, and after having braces removed.
Those three things are the primary reasons that we see people having gum recession. And that can start at a very early age.
And if left untreated, it can lead to tooth loss.
It's like a beaver gnawing at the base of a tree, right? It just slowly goes away, and ultimately that creates a lot of structural integrity issues for the tooth.
Before the pinhole surgery was perfected, not a lot of patients signed up for the old way of treating this condition, Dr. Blodgett says.
People would have to have incisions within their gums. The gums would be lifted up. You'd pull that down and then stitch everything back together, which caused quite a bit of trauma to the tissue.
Blodgett compared the old and new methods to advancements in knee surgery. Instead of opening up the knee, surgeons can now fix the damage with small tools inserted through small holes in the knee.
This is similar to that, but for gums, right? So Dr. Chow developed a technique where through one or two tiny holes, you can treat an entire arch of teeth where you've had gum recession. You can just go through that tiny hole using some specially designed instruments to gently move those gums back over the tooth and then support it with collagen.
Blodgett then uses a specially designed tool to gently move the gums back over the tooth and support it with a strip of collagen.
As it's being supported by the collagen, that tissue starts to reattach to the bone and the root surfaces.
Blodgett's patient, Jody Bolka, said after seeing her husband suffer through the old procedure, she opted to fix her gum recession with the pinhole method.
And the pinhole procedure seemed much simpler than the whole grafting procedure where you get bruised and you have swelling. It was very easy. Like post-procedure, I didn't have any pain. Follow-up was super easy. Yeah, it was great.
Brian Wood, KATU News.
A study of 43 patients with gum recession who had the pinhole procedure found the procedure just as successful as the old way with virtually no pain and no bleeding. You can find more information on Pinhole Gum Rejuvenation at KATU.com.